State
This conference will
ordinances
now be recorded.
and recordings. Yeah, a recording. There we go. So we can listen to this after, right? So things about safety, I think, are crucial. Preparing for workers to return, ensuring that you have the PPE in place. Where can we get them? What do we need? In addition to that, I think to Lois's point, we're going to be facing coordinating a number of different leaves. The CRA leave, the ADA accommodation issues, perhaps FMLA issues, and how do those intersect, as well as workers' compensation issues and disability claims. So coordinating all of those leaves, in addition to your paid time off leaves, are things that we will all talk about today.
Great. Thank you, Maria. As you can see, we have a lot to cover. And again, we want to keep this about you, the best and brightest community. The next segment we're going to move into is to bring up the questions that we received from you when you registered for today's session. And how this is going to go, I'm going to read the question and I'm going to tee it over to one of the panel, but it's very likely that more than one person will want to comment on it. And we are hoping that we can get 2 or 3 perspectives on all of these issues. So the first question was, we want to take every precaution. Can you ask employees if they have concerns about their health or underlying conditions we should be aware of, or do they care, or do they live with somebody with COVID conditions? That's the question. What can we do? Lois, Maria, I'll tee it over to you.
I mean, I'll just say,
Lois,
like, my initial, yeah, thank you. My initial reaction to that question is you don't want to go around asking people these types of questions. I would, yeah, right.
Be careful what you ask for, sometimes, right?
Exactly, because you're going to learn things. You're going to learn things you wish you never learned, and that will be held against you later on.
Yes.
I mean, I would communicate to all employees that if they have particular concerns, either about their own health or because they're living with someone who maybe is immunocompromised, that they, you designate someone in your organization that they should speak to about that, preferably someone in human resources, not their manager. And then you can talk through their concerns and see what accommodations, if any, need to be made. And certainly if employees are at work and they seem sick, you can ask them if they're experiencing symptoms of the virus. So you're going to want to stay, frequently check the CDC website because they're continuing to update what symptoms might be. And you're allowed to ask employees if they're having any of those symptoms and send them home if they are. But other than that, I wouldn't poll employees. I would just wait for people to bring their concerns to you.
Thank you.
I agree.
Maria,
with
anything
Lois.
else?
Yeah, I agree with everything Lois said there. I think you might want to direct employees back to your likely policies as it relates to requesting accommodations. Perhaps that's something that we could include in our compliance plan. And many areas are now not only just recommending, but requiring. I know here I'm in our Detroit office, and in Detroit, we have our Wayne County local order on health screenings. And so as you start rolling out those health screenings, and we're going to talk a little bit about that today when we address some OSHA issues, in those health screenings, that will disclose if a person has been exposed to COVID, if a person has any of those symptoms that Lois talked about. And I think beyond that health screening and that disclosure form that you will be distributing to your workforce and folks will be filling out each day before they come back into the office, I wouldn't go farther than that.
Thank you. I think you answered the next question is can a small business employer request or require their employees be tested for COVID before reopening for business?
Yeah, and you absolutely can do that. And now I'm not sure, and I don't know on your end of the on the map there, Lois, how available the testing is to date. We're told everyone can get a test. I don't know the availability there. Here in Michigan and in Detroit, just yesterday I had some folks that were tested, some friends and some neighbors. And so I think that they are becoming more available, but it'll be interesting to see Will employers be able to send folks for testing every other day or more frequently? So to the availability of the testing, I think that yes, you can. I think for new hires, you likely want to have new hires tested, and anyone who's been out because they have COVID before they return. And I think Lois and I and Sonia will all talk about the return to work and fitness for duty and that disclosure saying that they're able and they're symptom free and they're able to come back to work.
Thank you. Sonia, do you have anything to add from a policy perspective?
Yeah, being on the front line of HR, I don't want to be negative about it, but it's very known that managers disclose information or they could disclose information. I just want to remind all of our participants today that are on the call that confidentiality pertains to COVID-19 as it does for any other medical concern or issue that an employee discloses. And to Lois and Maria's point, I've always been one to designate HR to receive confidential information because they're trained on HIPAA and so on and so forth and confidentiality requirements. But, that's why you can't just go around asking people about their medical issues and so on and so forth. And COVID's not any different. So make sure as employers that we're sticking to the guidelines of confidentiality and what is disclosed stays confidential and it's not broadcasted. That's a large risk for employers. I think Maria and Lois would agree with that.
Yeah.
Yes, absolutely.
Thank you. Thank you. Our next question, this is kind of a specific question. Those who are at high risk, do they qualify for 80 hours of regular pay, or do they also qualify for an additional 10 weeks at 2/3 pay?
So I can address that, Therese. I can do it, Therese. So it's interesting. If you have an employee who's high risk but otherwise healthy and hasn't been exposed to the virus, they don't qualify for anything. But if you have someone who's high risk, whose doctor has advised that they quarantine because of heightened concern for whatever condition they have, then that person would qualify for the 80 hours of paid sick leave. But that's all they qualify for at least under the Families First Act. The only individuals who are entitled to the expanded FMLA leave, which is the 10 weeks at 2/3 of pay, are those who are caring for children whose school or place of care is closed or the child care provider is unavailable. So it's just a child care accommodation, and those are the only ones who are entitled to the 10 weeks at least partial pay. So if you have a vulnerable worker who's already blown through their 80 hours, then you can offer use of PTO, leave of absence, or maybe even a furlough so that they can collect unemployment. So there are other things that you can think about offering, but they do not qualify for they may qualify for expanded FMLA, just the regular unpaid if they're ill, but not under the Families First Act.
Mm-hmm.
Thank you.
So here in Michigan, Lois, we do have the ability to file for unemployment under our executive order. Is it similar in California? Is there an executive order in place that may apply or some other state order?
Yeah, I'm not aware of any state order that says just because you're at risk that you then qualify to get unemployment. So I think that you just, first, to get even the 80 hours under the Families First Act, you have to be under doctor's order to self-quarantine. Mm-hmm. But that's why I was suggesting if you have someone who's exhausted all of the paid options, then, maybe you put them on furlough, because if you furlough, then they can apply for unemployment.
And Maria, that's a really good point under Michigan. So I just want to ask this question. Under Michigan, as you just stated, they can apply for the unemployment, but they still have to prove out that they're at risk. So does that still require a doctor slip?
Yeah, likely as they apply for unemployment. And as employers, we can't promise that they will be granted unemployment benefits, right? That's completely up to the state. But to Lois's point, if you place them on furlough or offer them these different leave options, right? Is it short-term disability? Potentially, they still have to qualify for all of those different things. I think FMLA is, they have to certify that they have a serious illness or are caring for someone with a serious illness. So all of those rules are still in place.
Thank you. Our next question is, I'm going to direct this to you, Maria. This is somebody who is an essential employer. So they've remained open during the stay-at-home order, but they have half of their staff working at home. The remaining staff are on site as called for. They're planning a staggered approach for people to return, but there's going to have to be new safety protocols, distancing, the PPEs, all of that. And the question is this: what guidance can you provide to employers with employees that are afraid to return because of their safety or the well-being of their families?
Sure. So I think it's a great idea to stagger that return to work. And I have a lot of questions here from our staff and also from clients who's they're saying, okay, we're ready. The doors will open. What will that look like? And I think as you initially open your doors to bring every person back into your office is probably not the right approach. You may want to do that staggered return to work, right? Bring back those folks who really can't work remotely. I think while they're working remotely, you should be documenting those essential functions, potentially that they were not able to do while at home, and bring those folks back first that had some of their essential duties kind of put on the back burner while they were working from home. And then I think you need to look at the fear. Just plain old fear of personal exposure generally isn't going to be enough to refuse to return to work. So you'll want to peel that back. I know earlier Lois and Sonia and I said you don't want to ask, but when someone comes to you and says, I'm afraid to come back, I have real fears, ask them, what is the fear based on? If they have an underlying situation, right, potentially asthma or some other issue that may be compromised because of what COVID is, then you'll want to talk to them about that and determine whether or not you can accommodate them. I think it's really a three-step inquiry. What's the reason? What does the law require you to do? Looking at the ADA and maybe the FFCRA, and then what's the basis for the request? What other law might apply? What leave policy might apply as well?
Thank you. Any other comments from our panel?
I would
just say,
go ahead, Lois.
yeah, go ahead, Sonia.
I
was just going to say, I just recommend sort of more of a soft management approach to this in terms of dealing with the employees who have fears and whether or not they're rational or irrational. I do worry about managers who are a little bit too quick to just tell people they're nuts and, get their butts back to work. So just keep that in mind in terms of how you approach this, maybe a little bit more softly than you would have approached other issues in the past, and let your managers know that is the communication style that you prefer.
Thank you.
And
Sonia?
so I've been working with a lot of clients in the last couple of weeks on this very topic, and fear of COVID-19, an employer really can't reduce anyone's fear of COVID-19. I think the employees are more afraid of how they are going to contract it while they're employed, while they're at the workplace. So I've been recommending two things, and it coincides with what Lois was just talking about. First and foremost, regardless of what the executive or management team's personal opinions are about COVID-19, that everybody has the same message and they're delivering it cohesively to the staff. And then second, to prepare a formal communication, and I've given them the topics that they should include as a formal communication of what safety is going to look like upon their return, and to review that with each of the employees. And by doing so, you can get more information from them that might help you to even further develop those safety policies and/or communication and how to do things upon everyone's return. But if you can prove out to an employee that you've made the CDC and OSHA requirements happen within the workplace and you're taking all of the steps to keep them safe, I think that it'll reduce a lot of fears. But the communication has to go out before they return.
Thank you. Good point. Good point. I want to go to the next question, which is also about a person, an employee perhaps not wanting to come back to work, but it's not because of safety. What are your recommendations for bringing people back to work who would prefer to remain out of work to collect state and federal unemployment payments, which are greater than their weekly paychecks?
Oh, please, let me take this one.
No, me.
We're all gonna fight for this one. Maria had a comment earlier about, remember, we don't make determinations for unemployment. So if somebody has an active unemployment case, which in the example question that Therese gave us, my first recommendation to everybody is document the conversation. If you inform an employee that they're supposed to come back to work and they say no, and you ask them why, and their first response is, I make more money on unemployment than I do returning to work, that is something that the unemployment office is going to require the information, and you provide it. So we don't prevent people from receiving unemployment benefits. Our job is to report out the information that is requested and let the unemployment agencies in each state make that determination. So unfortunately, we can inform employees that refusal of work does need to be reported out. You know, most people are not going to stay home when they're not collecting anything, but that's my take from an HR perspective. I'd love to hear Marie and Lois.
Thank
Well,
you.
I'll just add that the Department of Labor actually updated their guidance just yesterday, and they said that workers who refuse to return to work when called by their employers cannot collect unemployment. So I believe that that will preclude them from collecting that federal supplement, and without that, most people aren't making more than they were making when they were working. So I think letting people know that if they decide not to come back to work when work has been offered to them, they're going to lose that supplement. That might be a powerful motivator.
Thank you. Maria?
Yeah, and Lois and Sonia, those are great points. I would add, Lois touched upon the Department of Labor updated their guidance. So I think that's a great resource for our listeners. The Department of Labor has issued a number of FAQs. They're updated regularly. So I would keep an eye on those. And so many of these issues that we're talking about have been posed by the Department of Labor and answered by the Department of Labor. Another good resource is the EEOC website. They have a great ADA FAQ on there about what you can ask employees, things that you know, are popping up. And so just keep an eye on those two very reliable and trustworthy resources to guide you as you're going through some of these return to work issues.
Great. Thank you. Here's, Maria, I'm going to toss this one over to you. And there's two different questions. Looking for advice on returning to the office, especially break room, coffee room protocols, other public spaces. And then the second part of it came from a different person, but it's kind of the same question. What are best practices? They want to reopen a workout place, a worksite wellness center, a group fitness class within their corporation. Any thoughts on how to manage that?
Yeah, I think those are great questions, and I think we can hear from our members that they're trying to balance a couple of different things, right? We know that keeping fit and doing some of these exercise and having these fitness classes, that's great for mental health. Unfortunately, at this point, maybe not so great for physical health, because we know that we are supposed to be social distancing as we return back to the workplace, right? So I would say you might want to hold off on the fitness rooms, perhaps, at least initially, as you initially reopen. Things in the fitness room that you will have to consider once we're ready to reopen those areas will be limiting the numbers. And so I heard, and I'm hearing so many very cool things from my clients as I talk to them, as they're trying to figure out practical ways to address the bathroom spaces in the cafes where people need to warm up their food and get a cup of coffee, right? And so I heard today a client has, you know, when you use like a portage on and you slide and it says in use, right? And so they said that they put out a little ticker that has, you know, each location, they will allow 3 people into the restroom. And so you click down, and once the 3 are full, then you know you have to wait outside in line and wait for the restroom. And so limiting restrooms usage to, you know, 2 or 3 folks. Closing down lunches, encouraging employees to eat at their desks. I know it's unfortunate and it's sad. We like to interact at work, but likely for the time being, you're going to want to limit the cafes to warming up food, maybe getting utensils, and doing some of those necessary things to eat and prepare the lunches. I think purchasing things like individually wrapped silverware, encouraging folks to bring in their own silverware. And my office manager and I have talked about just kind of walking around our space, taking a day to walk through the office, a day in the life of an employee, and looking at different things, even the stairwells. Should they be limited to one-way stairwells so that people aren't, interacting and crossing each other as they're going up and down the stairwells? If you have the capability to do these kinds of things, it will not be a one-size-fits-all. There is general guidance out there by the CDC and by OSHA. And so you'll need to look at not just your company, but each location and make adjustments for each location to determine how best you can monitor the workforce and ensure that they're being, that there's safety protocols in place, and that the social distancing is really being adhered to.
Thank you. Sonia, do you have anything to add to that?
I have a lot of clients that I've been working with that are staggering break and lunch times and start and end times for associates to make sure that there's the proper social distancing space in the break rooms. And I thought that was a great idea, so I just wanted to share that.
Thank you.
I also
Lois,
heard
any additions?
Yeah, I just also heard some other good ideas, which were making adjustments so that you have fewer people in your office. I mean, first of all, I would encourage employers who can to not rush in bringing people back, especially if you have now people working at home and it's working well, then there's really no reason to rush to bring everyone back to the office. So maybe take volunteers first, and then bring back other employees who are more needed in the office, as a way to just limit the number of people who are in the physical space. Another idea I heard was to change the work hours. So maybe some people come in at 6 or 7 in the morning and they leave by noon. And then other people come in at noon and they work until 6 or 7 at night. Again, just to reduce the number of bodies that are actually physically there. And then another idea was to maybe have an A team and a B team, and the A team works in the office 3 days a week, and then the other 2, they work at home. And then the B team works in the office 2 days a week, and then they work at home when, the other 3 days a week. So just think about different ways that you can do it so that, the fewer people in the space, the easier it's going to be. And the fewer people in the space, the easier it is to sort of like try out all of these ideas and tweak them before you have more people coming back in.
Thank you. This next question came up in our virtual HR forum before this town hall, but somebody said, Sonia, I want to send this over to you. How do we keep essential workers positive and motivated during these times? This employer is in a low risk area for the virus. Maybe it's outside of a metropolitan area, and they're taking all of the precautions. They've cut work hours. They're still paying people, but these are hard times for us as a small business, and our sales have dropped. And how do we keep people engaged and motivated? I know it's a broad question, but do you have any thoughts on that, Sonia?
I'm completely amazed at how our community is 100% committed to finding out how do we engage our workforce and during these times. And I've helped a lot of clients in the last few weeks come up with great ideas. I think for individuals who are furloughed or laid off, I would start putting together committees and special project committees that could help with the safety aspects of returning to work. Nobody knows the work floor better than the individuals who do the everyday work there. And that could be from manufacturing to retail to customer service. I think embracing our workforce as people who could, form committees and help us discover what those safety aspects will be of changing the work floor, the workspace, and having them be a part of the solution rather than somebody sitting in the sidelines and waiting for the employer to tell them what's happening is really showing signs of engagement. And if you think about looking at us all living in the United States, that's kind of what we pride ourselves in, as coming together and, winning everything and fighting through. And, look at Rudy and the movie Rudy. Has anybody ever seen that? So that's been working really well. Also, people that are furloughed and laid off, I'm working with clients right now that are doing things like a silent auction where everybody's cleaning out their closets right now anyway because they're home, and so they're donating items to a silent auction. The employees are given a website to go to and they can look at it and bid on items, and the proceeds are going to local food banks. And that's keeping people engaged. And then you have more project management and committees on actual virtual engagement opportunities. But I think the most important one, as we talk about returning back to work, and we can be creative as we want, but is really, how are we going to welcome back the workforce? Are we going to welcome them back with a thermometer in their face and a piece of paper that says, here's all of our safety changes? Or are we going to do that and have signs everywhere that say, we missed you, we're so happy you're back, you're the reason we are successful? T-shirts that maybe say, together we're stronger, and with the company logo on it. Just being really creative in helping employees alleviate fears of COVID-19. It seems like that's all anyone's been talking about. I know employees are ready to do something fun and exciting with their work teams, even if it's virtual. And last but not least is have daily huddle meetings, whether that's virtually or on the workspace, work floor, where employees can address and speak their mind about what they're seeing so far and how the safety measures are going, and do they still have concerns, do they have ideas, and just keeping transparent conversation and communication. So that's just some of the ideas.
Thank you, Sonia. Our final question that we received prior to the town hall, this is kind of a specific one, but I will put it out to all three of you. If an employer reduces an employee's hours to mitigate the COVID-19 financial impact, and an eligible employee elects to go on emergency family medical leave, must the employer pay the emergency family medical leave benefits for the reduced hours or for a full 40 hours?
I believe it's just the reduced hours. If they're working a reduced hours schedule at the time that the leave is requested, then that is what they're going to get, not their full, their equivalent to their full-time equivalent.
Thank you.
Yeah, I would agree with Lois that it is at the time that the leave is requested. That's when you analyze the hours.
Thanks. I'm going to move into asking some questions of each of our panelists to bring out some of the ideas that at the beginning of the session they said they wanted to expand on. Lois, we're going to start with you. And I'd like to ask you what employers' obligations are, their ongoing obligations under the FFCRA, and what are some of the concerns you see that employers are going to need to address?
Yeah, so just to remember the basics of the employer obligations under the FFCRA. So this applies to businesses with 500 or fewer employees. And this is the first time we've ever had any federal mandated paid sick leave. So it is something that employers are not used to, having to manage. And so, I mean, here in California, we've had mandatory paid sick leave for a number of years now. And so everyone's a little bit more used to administering this type of thing. But it is important to remember that employees are entitled to up to 80 hours of paid time off for a variety of reasons connected to the virus that prevent them from being able to work, such as they have symptoms of the virus, or they're being quarantined because of potential exposure, or because of being in a high-risk group. And so you would provide as many hours as they normally would work in a 2-week period, up to 80 hours. And the pay reimbursement is up to $511 a day. So for most people, that's going to be full pay. And then if you are unable to work because you're caring for a family member who has coronavirus, or you're caring for a child, then you're entitled to 2/3 of your regular pay, up to $200 a day or $2,000 per employee. And there's no time in position requirement, unlike other sick leave laws or the FMLA. So if you just hired someone, right before all this started, then they're eligible. Or if you just hired somebody yesterday, because a lot of businesses are still hiring, then they're eligible as well. So just to keep that in mind, and right now that's in effect until the end of the year, and we'll see if that ends up being extended at all. Probably depends on how prevalent the virus is. And then just to remember the obligations under the expanded Family Medical Leave Act. If you have, this is where the employees who have childcare challenges may be reaching out to you, especially as summer comes, and if they cannot work because they really need to focus their time on their child or children who are out of school and also don't have summer camp or any other place to go. So they are entitled to up to 10 weeks of pay at 2/3 of their regular rate of pay, up to $200 a day or $10,000 per employee. And just remember, you do get the payroll tax write-off to help offset the expense of this. So make sure that you get appropriate documentation in case your ability to take that deduction is questioned later on. And then just some cautions. I don't like to scare people to death, but one reason we're all here is because we're afraid of getting sued after things open back up, because that's just, that's what happens. There are plaintiffs' lawyers out there now trolling for clients. Mm-hmm. And so under the Family First Act, there's a lot of hidden liability. There's a $10,000 fine for violation, in addition to general damages and back pay and front pay, up to 6 months in jail, if you can believe that. And I can tell you, if you go to jail for violation of the Families First Act, you will not get the top bunk. So just keep that in mind. There's also recovery. I know, right? So that's my one joke for today. Okay, we're done. There's also recovery of attorney's fees and costs, which again makes litigation very expensive. And you can be sued individually. So, if a manager is involved directly in denying this unlawfully, then the manager, can be sued, and nobody wants that. Also, the Department of Labor can bring lawsuits. If you're a smaller employer, 50 or fewer employees, you can only the DOL can come after you. If you're more than 50 employees, then you're right for any private litigation. And the DOL is actually out there working on this already. So there was a brief grace period where they said we're not going to engage in any enforcement activity. That's now expired. And so they did actually issue an enforcement order against the Tucson, Arizona electrical company who denied paid sick leave to an employee after he showed coronavirus symptoms and was told by a doctor to self-quarantine. So the employer was ordered to pay $1,600 to the worker, which was his, the amount of his wages for the 80 hours. And then there's already been a lawsuit filed against Eastern Airlines for firing one of their directors days after she requested leave to care for her 11-year-old son. So the enforcement actions are happening, whether, from the government or from private attorneys. And so, keep those obligations in mind and don't forget about them as we go through the summer, the fall, and the beginning of the winter.
And you bring up another point is there's likely to be increased lawsuit activity. How can employers mitigate the risk? How can they reduce the risk of lawsuit?
Well, there are a lot of things that you can do. I think the primary thing, and I think Maria might get into this in a little more in depth, but make sure that you're following all of the CDC guidance, any guidance that OSHA puts out. Federal OSHA has been somewhat resistant to issuing specific regulations for employers to comply with, but many states have their own version of OSHA. Like here in California, we have Cal OSHA that may, so make sure you're checking not just federal OSHA, but any of your local OSHAs and any other state and local guidance, because sometimes it's just cities that are putting out their various requirements. So, make sure you're complying with all of those safe workplace regulations. If an employee thinks they got coronavirus at work, it's interesting. I would think it would likely be a workers' compensation claim. And there may be some challenges in proving causation in terms of where they actually got it. But I did read this morning in Law 360 that some states have recently eased this burden by presuming workers with COVID got it at work. And it didn't say which state. So it's not California for once. This sounds like something that California would do and may still do in the future, but they have not done it yet. So I do not know what states these are, but something that you might want to check in your individual state. the U.S. Senate, they're trying to work on another package of relief, and the Senate is pushing for some protection from liability for employers, for employees who get sick at work. But whether or not they're able to accomplish that or not, there's not going to be protection for any grossly negligent conduct. So if you're grossly negligent, that's going to take the matter outside of workers' comp and definitely subject you to litigation for failure to maintain a self-work environment. So, keep that in mind, and also keep in mind that these, post-COVID claims are very susceptible to class action litigation. And, I am aware that there are plaintiffs' attorneys out there already trolling for class reps. So, it's astounding, but 187 new laws have been enacted in the last 30 days. So really, what could go wrong? I will just end on saying, I do think that the primary claim you're going to see is retaliation. For someone trying to enact some protection or get some pay under one of the laws, or something disability related. The retaliation claims are, I think, going to be the driving force here in the litigation boom that I expect to occur, unfortunately.
Yes.
Sure. Thank you. And I think Maria's going to address some of that in when we get to her section. Anything else, Lois? What about potential harassment claims from people who are in protected classes? Do you see that as something to be considered?
Yeah, this can come up in a couple of different ways. First, you want to avoid triggering EEO claims in the course of trying to get your business back up and running. And so you need to think about, if you are reducing hours or wages, is that across the board? And if not, how did you choose the groups who are subject to those employment actions? Same thing with the decisions to bring employees back to work. You may not need everyone at once. And so you need to come up with objective criteria for deciding who you're bringing back, unless you're doing it, unless everybody's coming back, or unless you're doing it based on seniority or something super objective. But if it's based on something else like skill set or, past performance, you need to be very specific about what that criteria is and why you're choosing the individuals that you are to bring back. Or, you're going to get claims about, failure to rehire, especially I worry about age-related claims. A lot of employers' instinct might be, I'm going to bring back my younger folks first because they're not as susceptible. And I'm concerned about my older employees, and so I'm going to keep them out. And then the older employers are like, hey, I'm healthy, I'm ready to come back. And you just discriminated against me based on my age. So you have to be very sensitive to that and thoughtful about how you're doing things, and just remember, no good deed goes unpunished. So if you think you're acting in someone's best interest, that might come back to haunt you. You also have to think about, pandemic related harassment based on things like national origin or race or other protected characteristics. So, company management is going to need to be sensitive to harassment of Asian employees because of where the virus originated, and potential harassment or discrimination against those who've had the virus or maybe are perceived to have the virus, but they don't have the virus. And then there's potential harassment I could see based on if you're a person at risk because you're older, you're obese, or you have some other risk factor that, people are aware of. I can see harassment of people based on that. And so you need to make sure that your managers are on the lookout for that, and that they nip it in the bud and communicate to your employees that, this is not going to be tolerated, so that you don't have claims that arise from that type of behavior.
Mm-hmm. Thank you. I was going to ask this to Sonia later on, but Sonia, would you talk a little bit about practices or tools that would help compliance through this onboarding process relative to some of the things that Lois just shared?
Yeah, I as I sit here listening, I've handled HR legal compliance and legalities for many, many years. And I think one of the areas that all employers should be looking at, because although what Lois is saying is absolutely 100% true, we can't base it on he said, she said, or he said, or documentation has never been more important on the employer's aspect and side. And by standardizing all of your processes and your onboarding documentation, your offboarding documentation, even making sure and ensuring your harassment policies include situations that Lois just talked about, revamping those policies, having standardized templates for furlough, termination, layoff, and even communication that clearly stipulates this affects all employees. If we don't have the right documentation, Lois and Maria can't defend us well. And I can sit here and tell them both all day long that she said this or he said that, but unless I can prove it in writing, it's generally on the side of the employee and not the employer. So really understand the importance of documentation and revamping all of your templates and policies and procedures, not just for efficiency, but to assist in employers doing the right thing and not having the risk that we're talking about. We are the front line in mitigating that risk, so Lois and Maria can assist us if we need them in the future.
Thank you. I'd like to put this question out to both Maria and Lois. I'd like you to talk about coordinating leaves of absence and reasonable accommodations under the ADA. Maria, would you like to start, and then we'll pass it over to Lois?
Sure, I'll take it from a non-COVID perspective. And so we have to keep in mind, we have, everyone's focused on COVID, but we still have the good old FMLA and the ADA, right? So I think you need to keep those two laws at the forefront of your consideration. If someone comes back and needs an accommodation in the workplace, you'll need to engage in that interactive dialogue and talk to that person, determine whether an unpaid leave is appropriate or what the accommodation request is. And then if they are eligible for FMLA, which is different than the EFMLEA, the qualifiers, right? So we know under good old FMLA, you have had to work for the employer for at least a year, and for 1,250 hours, that's not the case under the new paid leave laws, both the paid sick leave and the emergency FMLA. So looking at all of those different options, look at your paid time off as well. A lot of us have short-term disability policies. So you've got to consider all the different leaves available to the employees, and then engage in that interactive dialogue to determine how you can accommodate. And we know under the new paid leave laws, there are some intermittent leave opportunities that may be something that you'll want to consider, in particular under the EFMLEA, right? The 12 weeks of paid federal leave to stay home and care for your own child. And maybe the employee will say, look, I only need to be home on Tuesdays and Thursdays, and my spouse will be able to manage on Monday, Wednesday, Friday. Is that something that you wish to accommodate? You should engage in that dialogue. Oftentimes, you'll perhaps say, I'd rather have this person in the office 2 days rather than no days, or back to work 2 days a week rather than putting them off on the full 12-week leave. And to Lois's point, this is to go on for many months, right? We know our kids are home for the rest of this school year. That takes us all the way until likely the middle of August at least, where a lot of our employees are going to have children, school-age children at home who are going to need to be cared for. And so how will we accommodate our workforce, and how will we accommodate these childcare issues? And maybe an intermittent leave is going to be something that is a good option for us, and that's been permitted in those new leave policies. Lois, I'm sure you've got, and you in California have your paid California leaves that you also have to consider. We do have paid leave here in Michigan as well for 40 hours.
Yeah, we do have, we have various things here. We have the paid sick leave laws, and then we have like the family care type leave that employees may also be eligible for. I would just, going back to sort of ADA 101, just remember that, leave is an accommodation in and of itself. And so if you have an employee where you sort of run out of options in terms of creative ideas for how to accommodate whatever their issue is, connecting back to the COVID now, you can always offer them a leave of absence, and if they have exhausted all of their paid time off options, then it may, have to be an unpaid leave of absence. Employees who have the virus, likely do qualify for FMLA leave, and those who are caring for family members who have the virus also likely qualify for FMLA leave. It's just like any other condition where you get the certification from the medical provider saying, this person is needed for X amount of time to care for the person. So, just remember that as well. And, employees often do like to get those, just the, sort of the added protection of, of a job protected leave of absence. And then just something to remember, especially with the employees who may be using that emergency FMLA leave to care for children at home. I mean, it's 10 weeks, which is quite a lot. But just keep in mind that these laws do not expand the total amount of time that FMLA, that employees are entitled to FMLA. So 12 weeks is still the max. And so if you have employees who have already taken some FMLA this year, then they may not be eligible for the full 10 weeks. So it's still 12 weeks within a 12-month period. So any way you slice it or dice it, they're not entitled to go over that. And so something to keep in mind. And then just to, Sonia's point a minute ago, especially when it comes to the interactive process, make sure you document everything, every conversation, everything that was requested, everything that was offered. Make sure you ask the employee, like, what ideas do you have? Because often they'll just say, they'll come and they'll say, I just need some kind of accommodation, but they don't really, maybe they just had like, oh, well, just give me paid time off forever. So that's obviously not feasible. And so you have to keep probing to see what they think they need. And of course, you can still just, like before, ask for doctor certification of the disability and the need for the accommodation, and make sure you understand from the employee how the accommodation is going to help them perform their essential functions. And then the interactive process is an ongoing obligation. And so it's worth, if you've had to go through these steps with an employee and you've, arrived at something that is agreed to by both parties, follow up on that, put a reminder on your calendar to follow up with the employee maybe in 30 days and then like another 60 days and make sure the accommodation is still working. It's just a best practice.
Thank you. Maria, I want to shift over to you, and I would like you to maybe expand on the OSHA regulations that employers need to be most aware of as they're bringing their employees back. What are some of the things you'd like to share?
Sure. So we've talked about that return to work is likely going to be in phases. And we have to keep in mind not just our OSHA obligations, but also our state obligations. We've got so many executive orders that have been issued here in Michigan. I'm sure it's similar for Lois. And then countywide, and some are even citywide. So I think you need to look at each location and make sure that you are following the laws in each location. Reopening will require increased flexibility, and critical to the success of reopening any location is communication. I loved what Sonia said earlier, that you want to engage your workforce, and a great way to do that is to bring them to the table as it relates to establishing these plans and looking at the office and determining what some best practices might be and getting them to buy into those plans that you're developing. It's not going to be a one-size-fits-all approach. We talked about looking at it per location rather than company-wide, because we know each location, just the physicalities of it, it will vary by each location. So Lois mentioned that OSHA has been, they've pushed back and haven't given out particular guidance and have not issued particular regulations related to COVID. And some have criticized OSHA for this, but expect to see more as this continues. OSHA has, by and large, recommended that employers follow CDC recommendations with some industry-specific guidance, such as for the construction industry and manufacturing industry. And if you don't already have one, you've heard us discuss today about developing a plan that can help guide protective actions against COVID-19. Plans should consider and address all levels of risk associated with the various work sites, looking at the job tasks, and you'll want to include in those plans basic infection prevention measures, something simple like, I heard one landlord talk about looking at their air filters, installing high efficiency air filters, increasing ventilation rates in the work environment, installing physical barriers such as clear plastic sneeze guards in between our cubicles. How can maybe rising those cubicles up, right? So you need to walk through your facilities and see what needs to be addressed. Look back on your policies and procedures for identification and isolation of the sick. If folks can stay home, as Lois mentioned, try and take it slow. Don't bring everyone back on day one. If people are working from home and doing it well, let them continue working from home. And then you've got the catch-all of follow your existing standards. Also, in instances where an employer is unable to comply with OSHA mandated training and audit and inspections and assessments or testing requirements, local authorities may require the workplace to close. So keep that in mind. I think a very basic way to avoid having employees try and pierce through the workers' compensation. We heard Lois talk about that earlier, right? We're generally limited for personal injuries to workers' compensation claims in our workplace, but there is that ability to pierce through if the employee can show a reckless disregard. I think this is going to be a prime opportunity for employees and for plaintiffs' attorneys to pierce through that, right? And to say, you know what, basic protocols were not adhered to here. I came back to work and all of these things were being violated. That's going to be an easy opportunity for employees to pierce through and do these class or collective type class actions, I should say. So have some basic infection prevention measures in place and your plan in place to return.
Shania, what are you seeing among your clients as far as tightening up those kinds of policies?
So I absolutely love what Maria and Lois talked about. And Maria, just to go to you for a moment, in the HR world or even in business, non-legal, we know that we are responsible to provide an environment that's free of physical harm, but we always forget that we're also required to provide an environment that's free of physical harm and illness. And like Maria was saying, we're so used to workers' comp being a physical harm issue, and now with COVID-19, what I'm seeing is a lot of employers are overwhelmed. What do I do? There's so much information out there. So I've kind of created a topic for the communication for ensuring the safety, and I work from the workers' comp side on the HR perspective, not the legal, of course. But here's the topics that I have helped create with employers. What do we need to avoid in the workplace? What are the workplace expectations for me as the employee? What is my contribution expectation? What's the protocols for employee screening? We haven't mentioned this, but you can't just take the temperature of the manufacturing floor and not take temperatures of the office staff. You have to be compliant in one for all in your screening processes, whether that's hiring a new associate, which Maria talked about earlier, and then protocol for notifications and cleaning if COVID-19 has tested positive in our workforce, in our work areas. CDC guidelines are extremely important. OSHA, what communication employees can expect, what's our infectious disease control policy, what is our written reporting policy. If I'm an employee of company X, how am I required to report and who am I required to report to if I'm showing symptoms? And then, of course, we always need to be mindful of how we're going to include the confidentiality clause in that their medical condition and name will not be given to others. And so that's what I'm seeing right now is helping to mitigate the possibility of workers' comp by having everything in writing under those. And that seems to be assisting with employers here in our area. I'm sure a lot of employers are still overwhelmed with what does that look like. So hopefully those topics can guide them.
Thank you. Thank you. Maria, what about anti-retaliation protocols that you would suggest? That was something that Lois kind of hinted at, that might become an issue. Can you talk a little bit about that?
Absolutely. I would hope most of us have anti-retaliation policies in place. I think we should include that as part of this compliance plan. We want you to come forward. If you feel that we haven't done something to ensure your safety in the workplace, please let us know. Give us your suggestions. Tell us what you want. And ensuring that folks can come forward and there's that open dialogue, making them feel comfortable to come forward with any concerns or reports. Again, going back to what Sonia noted, bringing folks in, bringing them to the table, and having, I've heard folks refer to as lieutenants, even just floor lieutenants, or captains in the various buildings, and then each floor has a lieutenant so that folks can feel comfortable going to that person with their concerns. The more folks I think you bring to the table and have them buy in to the safety and plan of the workspace, the better off you'll be. But just ensuring people that that dialogue is open and free flowing, having regular communications with your employees, being visible, and updating them on what you're doing to keep them safe, making them feel comfortable to come forward with their concerns will help eliminate any concern of retaliation. Going back to your traditional policy. Yep.
Great. This is a good place to segue to Sonia, because I'm sure you have some comments about what Maria just shared. But then I'd like to talk a little bit about this idea of the welcoming return of employees, and then talk a little bit about communications. We're 8 minutes past 3, and I want to make sure we keep enough time for questions that have been asked by our participants. So Sonia, could you first talk a little bit about any policy or protocol advice you have on the anti-retaliation issue?
Yeah, absolutely. I really hope that a lot of employers weren't caught off guard with an outdated handbook that doesn't address harassment, retaliation, subject to who they're required to report to. But all of this can be prevented regardless if we're in COVID-19 or we're not in COVID-19 with specific policies. So, in short, I'm just going to say this is the actual map that I give to the clients that I'm working with. Look at and review all of your policies, including harassment, retaliation, who to report to. Don't forget to look at your leave policies. Your handbook overall should represent what the employee needs to know to be successful within the workplace, and that includes all relevant acts, laws, and guidelines. And then after you've looked at those, create those standardized checklists, all the leaves that are available right now, the 187 new laws that were put in place. So, before it was FMLA, now it's FFCRA and HR 6201 and EL, and I could go on for days. What does your leave form look like? Does it have all those types of leaves on there? And then I'm going to leave everybody with this, because this is a topic I could speak on for about 2 days. I think the most important thing is making sure there is plenty of training. Right now, we're still all at home. You can use learning management systems like a Think HR to issue harassment, diversity, inclusion, and retaliation training to your supervisors and leadership. And make no mistakes, we will be working with Maria and Miss Lois if we do not ensure that our management team is cohesive and expressing the exact same message verbatim. As we look at Facebook, as we looked at LinkedIn, as we look at all of our social media outlets, we're seeing many opinions. There are a lot of people out there that think the whole stay-at-home order in place is a coup, or I don't know. But and people are like, hey, I'm just going to go out there and get the COVID-19, then I don't have to worry about it anymore. We are working with individual people, but when they come to the table in a workplace, they are obligated to respect the employer's wishes. And I just think cohesivity and making sure that your management teams, team leaders, supervisors, that they are leading by the example of what the company's expectations are in this communication. And that's the biggest risk employers face, is not consistent messaging by management. So executive teams, make sure your management team understands and they are trained, and not to retaliate, not to make comments, but to represent on the side of the company and what their expectations are.
Thank you, Sonia. Anna, I'd like to open it up to questions. Can you let us know what questions have come up?
Yes, we have several questions. The first one is it mandatory to distribute the company response plan to employees? If so, will posting on the company intranet suffice?
Who would like to handle that one?
I can take that. I can take that one. And Sonia as well, right? I don't know that it's mandatory. I would say it's absolutely recommended. You want your employees to be aware of all the good things that you're doing to ensure that they're safe. And so absolutely, you'll want to get them a copy of all of the good safety measures that you're taking and updated precautions that you're taking in the workplace. I think it's fine to post it on the company intranet. I'd also email it to them. I would make it available as best ways that you can. And to Sonia's point, they're all home, so potentially a company-wide email will reach everyone the fastest way possible, right? So I would say distribute it. Sonia,
You know, one
agree?
of the things that I've heard in the forums is not just email, but also social media, also text, also regular mail, also on the company website, the intranet, any possible platform to post it.
So I'd like to add something important for all of us to think about here. If we remember going back to the conversation earlier, and of course, again, I remind people I'm 20 plus years in HR and I've worked on a lot of legal matters. If we cannot prove that they received it, what's our risk in the future, especially with workers' comp, as Maria and Lois have shared with us? I think it's really important that just like with any acknowledgement, if you're posting changes in policies and changes in safety and so on and so forth, it should be posted everywhere, number one, not just email. Email's the best way, right? Or on the intranet is really easy. But at some point, we have to prove out that that person received it. And this is, of course, worst case scenario. Because it's really easy for an employee, and I know everybody in HR has dealt with this, for an employee to say, I never received that information. So be mindful of what risk it could cause moving forward by not having someone sign off on something and not have it posted everywhere, and only using email or intranet accessibility to it.
Yeah, I was going to add for the workplaces that, there are a lot of workplaces where people don't have email. So it's going to need to be posted there. And then also just be mindful of your employees who don't speak English. And if you need to have these policies translated into, whatever the predominant language is spoken by your employees, you should do that as well. And then I also thought of communicating not only this is what we're doing for you and to keep you safe, but also, this is what you can do to help us. And, something along the lines of a pledge of like, I will not come to the office, if I have any of these symptoms. I will not come to the office if I'm sick, which is in general just a good policy anyway. And then, look at the policies that you do provide and consider whether you can afford to maybe increase your paid time off. To encourage people to stay home, because when people start running out of paid time off, it's going to be a little bit trickier to keep them out of work when they need that pay. And there will be people who take advantage of it, so that's just a given. So a lot of employers don't want to do it for that reason, but I don't think that that's a reason. We're living in different times now, and so I think we're going to have to accept a certain level of that.
Thank you, Sonia. Anna, what do we have next? Another question.
The next question is, how do we test employees when we don't have tests? And how do you ensure safety to your team if you're not able to test daily?
Can I ask a clarification question on that? So employers aren't able to actually issue the test, but they are actually able to screen. Maria, Lois?
Yeah, so you can do screening. You can take the temperature. I think it's only of limited help because it seems like quite a number of people who have this virus don't have temperatures. So it doesn't really tell you that much. You can certainly keep an eye out for people in the workforce who might be exhibiting symptoms, and take them aside and ask them if they're having these symptoms. I'm not super big on the testing, I have to tell you, because, you know, like Maria was talking at the beginning of the program about, you know, you have to test people pretty frequently because it's a snapshot in time. Do they have the virus today? No, they don't have the virus today. And so it's really impractical to send people for testing. First of all, if you're the employer and you're requiring testing, you're going to have to pay for it. So there's all this talk about it's free, free, free. But I have heard that if you just show up at like a Quest Diagnostics and you don't have a doctor's prescription for the test, that you're being required to pay for it. And I think, you know, they don't want to be flooded with employees, you know, of the same company every single day getting tested. I just don't think that that's practical. The antibody testing might be a little bit more helpful in terms of informing who's already been exposed to the virus and then therefore might be at lower risk. That hasn't been specifically allowed yet by the EEOC. They only talk about testing for the virus itself. But I do think that that guidance should be updated because the antibody testing is a little bit more telling. And so that's something that you might want to send your employees for. I would also be very careful about making some kind of testing a requirement for coming back into the workplace. I mean, obviously, if you're a nursing home or a hospital or something like that, it's a different circumstance. But just in, you know, your average everyday workplace, it puts a burden on the employee and also potentially stigma to say, you know, you have to have tested negative for the virus or you have to have tested, you know, positive for the antibodies before you come back to work. And I think you're setting yourself up for some sort of a claim if you, you know, demand those strict protocols.
Thank you.
I agree.
Anna, next question.
The next question is, in an organization that has both W-2 and 1099, if you let some go and keep others, is there a concern that the ones let go could sue for letting them go? And how do you arm yourself against legal action?
Yeah, I mean, I think this is what we talked about before. I mean, first of all, if you have 1099 folks, they're not technically your employees or they shouldn't be your employees. So there's arguably less risk of them saying, you know, you didn't bring me back. I would think that you would give preference to your regular W-2 employees first. And it's just all the things we talked about. Just be careful, you know, bringing people back. What's your criteria if you don't need everyone? How are you selecting people to bring back, and make sure that you're not creating an EEO claim in the way that you went about bringing folks back. But I don't see any EEO claim just distinguishing between W-2 employees and 1099 contractors.
Thanks. Next question, Anna.
How much leeway do we have to reduce hours?
I think you have leeway there. I can jump in on that one. I've given a lot of guidance on this week, in fact. I think you have to be careful with your exempt classifications on how you do that, right? And so we know that if you have a 40-hour typical work week and you are reducing hours and reducing pay, you have to do that prospectively as it relates to exempt employees, because any time that they work in that work week, they have to be paid for the full work week. But prospectively, you can reduce salaries and you can reduce hours for hourly employees. That's typically not an issue. Here in Michigan, we're all at will unless we have a contract of employment that promises a set salary. And so take a look at that if you're talking about, and typically in Michigan, that's limited to executive employees. In many states, it's limited to our high level folks. So unless you have a contract that promises a set salary, you should be able to make that reduction, in particular for hourly. And then again, for exempt, just be careful how you do that. Make sure it's prospectively.
And if I might speak on something that I've done for exempt employees when reducing salary, it's important to include that you're reducing their work expectations as well as salary and get them to sign off and agree to that, making it less of a risk for them to pose a legal issue in later date. So get it in writing.
Good point. Thanks, Sonia. Another question, Anna?
If you have over 500 employees, but all in different states, does this exclude the employer from FFCRA, or is this looked at by state?
I didn't hear the beginning. Do you mind reading the question again?
If you have over 500 employees, but all in different states, does this exclude the employer from FFCRA, or is this looked at by state?
Yeah, so if you have more than 500 total, then you are excluded from the FFCRA, but you have to be careful because a lot of localities have enacted laws to provide protection to employees at those larger employers. Los Angeles in particular, and California with respect to the food service workers. So don't assume, you're scot-free. So you may have, if you have employees in these locations that have adopted enhanced protections for employees at the larger employers, then you need to comply with those and just make sure you don't miss those.
And Lois, the number, correct me if I'm wrong, the number of associates counted is based on their employee identification or EIN?
It's their employee identification or what? Sorry.
Their FIDE number, yeah. EIN.
Right.
So it doesn't matter what
And
state
also-
they're in.
No, it doesn't.
Right.
And keep in mind as well
Right.
that if you're teetering on that edge of 500, then you should make sure that you look at it at the time that the leave is granted, or I'm sorry, requested.
Yes, that's absolutely right.
Mhm.
Thank you. Anna, what do we have next?
Do you get the tax write-offs even if you got PPP loan?
I don't know. I'm having a little bit of trouble hearing. What was the beginning of that? I heard the PPP loan part at the end.
Do you get the tax write-off
Oh,
if you get the, is that
yeah.
what I
So
heard,
it's two
Anna?
different. Yeah, it's two different things. I'm not an expert on the PPP loan, but I do know that if you are providing the leave under the FFCRA, the 80 hours of paid sick leave, or the 2/3 of pay for the individuals taking time off to care for children, that is a payroll tax deduction, and so that has nothing to do with the PPP. And you still get the deduction even if you also happen to get a PPP loan.
Yeah. And under
Next,
the,
Anna? Oh, go ahead.
sorry, I just wanted to add to the PPP. So on top of what Lois just disclosed on the PPP, if an employer is approved for the PPP but has not yet received approval for the forgiveness, they can also defer the applicable taxes. And I would recommend that you look that up under the PPP guidance.
Thank you, Sonia. Do we have another question, Anna?
Yes. What are the options if an employee has young children that already used the 12 weeks under the FMLA? The leave is up in midsummer and they have no childcare due to the summer camps being closed. Besides unpaid leave, what other options are there?
I can take that one. I think in that circumstance, if the employee is able to work from home, and we can do that teleworking for that employee, that's always an option. Just be careful about the way you apply the teleworking. So if you have 2 employees, for example, one with kids at home, another employee wishes to work at home, just consider that classification, right? Again, this goes back to bringing folks back a little more slowly and not reopening the workplace and having everyone come back at the same time. So that person as an accommodation can telework. You can do the unpaid leave. You could furlough that person. And if they need to be in the office and the work requires, the essential functions requires, let's say it's a plant location, so they have to be at the plant in order to perform the job duties, you might need to furlough. It wouldn't really be an ADA option. And again, to Lois's point, you're only required to do the 12 weeks, and you will only get the tax break for the 12 weeks, 2 of the paid sick leave portion, and then 10 for the EFMLEA.
Thank you. We have time for probably 2 more questions. Anna, do you want to give another question?
Yes. What happens if an employee has symptoms and does a self-quarantine but has no documentation from a doctor? Do we move forward with leave options?
I mean, I think the first question is, do you need to pay them the 80 hours of paid sick leave? And I think it's appropriate, even though the CDC says don't ask for doctor's notes, I do think it is appropriate to ask them for a doctor's note. So not everyone is getting tested. A lot of times, employees who have symptoms are just having like these telemedicine visits, but it's not as hard as you might think to get. I mean, as long as they're not in the hospital, the emergency room or something like that. But I mean, I just had like a telehealth, visit myself the other day. The doctors who just do like primary care, like in offices and are not working in hospitals, they don't seem to be all that busy actually. So I think it's totally appropriate to ask for a doctor's note. And then, if they've been advised to self-quarantine, because it sounds like they might have the virus, then, then you have to look at whether you need to pay them that 80 hours of paid sick leave. And then they may also be entitled to FMLA leave because it's a serious medical condition.
Thank you. One more quick question, Anna.
The last question is, what is the obligation to provide masks to employees? Is this just one mask, or make sure their supply, is one mask enough, or do we need to supply for daily use?
I think it might depend a little bit on what kind. Yeah, why don't you go, Mary, because I know that you're kind of like more up on all the OSHA requirements and workplace safety requirements.
I'm sure we're all totally qualified to answer this one. I think you do the best you can. Again, I'm going to pick on Michigan here. We've said that if you do not have the capabilities to provide masks to employees, that you can encourage employees to make or bring their own masks. So, I think you need to, again, look at the local guidance and requirements, and then look at your state obligations. But I'm not aware of any location that is mandating that the employer provide face masks every day to its employees. I think that most states are recognizing the difficulties in obtaining these. So I think you encourage your employees to bring in their own mask every day and start looking now to order. I just got a text this morning that we were able to find some masks for our office. So keep an eye out and look for and purchase what you can, and otherwise have employees bring in their own. And it's even the CDC has said it does not need to be medical grade face coverings. It can be anything so easy as just a bandana around the mouth.
Maria,
I would just be mindful of what your workplace is and how much how sterile it needs to be. So I think for an office environment, like the cloth masks or bandana is totally fine. But if you're in food service or certainly anything healthcare related, you're probably going to want something disposable that the employee can get a fresh one every shift. Certain employers have certain obligations with respect to providing the PPE. And so it's going to depend on sort of what category of workplace you're in.
Okay, and Sonia, I think I'll give you about 15 seconds because we have to wrap up. Go ahead, Sonia.
I was just going to say, Governor Whitmer has issued a requirement for all employers in the state of Michigan to provide masks. And one of the questions that I have been posed the last couple of weeks is they're concerned about employees refusing to use the mask because they feel constricted or hyperventilating, or and what can we do about that? So
yeah, so I've seen the shields as well being used, and we know that our Attorney General came out with a statement saying that she recognizes the difficulty of employers to provide these masks every day. So she would work with law enforcement to not enforce that. So, I mean, do your best, show good faith efforts. I think that's what's going to be required, and do the best that you can to provide that PPE to your workforce.
Thank you. And I want to thank our panel again. Maria, Lois, Sonia, you've shed light on so many issues and uncovered a few too. Thank you for so generously sharing your knowledge with our best and brightest community. Today's town hall will be available next week on the bestandbrightest.com website. And our next COVID National Town Hall will be on Wednesday, May 13th. We will be going deeper into OSHA and talking about the payroll protection program, what's forgivable, what's not forgivable, and what are employers required to track. Registration will open soon. Please refer to thebestandbrightest.com where our COVID-19 resource page where you will find all that information. Once again, thank you to our panel and thank you to everyone who participated today. We hope you have a wonderful rest of your day and we'll see you on May 13th.
Thank you.
Bye-bye. Thank you.
Bye, Maria. Bye, Lois. Thank you.
Bye.
Bye, Sonia.
you.
Bye, Lois. Bye, Therese.
Bye, Trace.
Goodbye.